Good morning. Welcome to WJCT Public Broadcasting. On behalf of all of the staff here, we're very, very delighted to see all of you today. Thank you for being here. Beautiful day, and we're excited about bringing this great presentation to all of you on behalf of the Jacksonville Hearing Balance Institute. If you'll allow me, on behalf of my president, Michael Boylan, and the whole staff, your viewership and listenership is much appreciated. Thank you very, very much. So, my name is Harold Samuels. I'm with corporate marketing here, and I'm here to introduce Dr. Green, but a little bit about the Hearing and Balance Institute initially. The Jacksonville Hearing and Balance Institute, a medical practice that was founded by Dr. J. Douglas Green, Jr. in 1997, specializing in the identification and treatment of hearing and balance disorders. So, Dr. Green, as the founder, is a neurologist, a subspecialty of ENT that focuses on disorders of the ear. And he is recognized both nationally and internationally in the treatment of ear disease, inner ear, and skull-based surgery. Dr. Green has written 8 clinical book chapters and has had 36 scientific articles published in medical journals and has given dozens of oral presentations on his scientific research and the work at peer-reviewed meetings. Dr. Green has also been involved with multiple international medical mission trips, and because of his experiences, has created a nonprofit organization called Hearing Help for Africa, which provides short and long-term otologic hearing and health care abroad. So with no further ado, I'd like to bring Dr. Green up. And again, we appreciate you and thank you for being viewers and listeners of WJCT.
Thank you so much. Appreciate it.
All right.
Thank you.
Thank you, Doctor.
Well, thank you very much for coming today, and we're excited to have such a great turnout, and we're grateful for WJCT for allowing us to put together this presentation. We want to talk to you a little bit about hearing loss, and then as we kind of transition to how hearing loss can affect the way we think. It can affect our cognition is the medical word that's used for that. But so let's move forward a little bit about us, that there's a photograph, and we're thankful to be celebrating 20 years here in Jacksonville, and many of you have been with us for a number of years, and so we're thankful for all that you've done to allow us to keep the practice going for these 20 years. We have many different services that we offer, everything from very simple things, removal of earwax, to more complex problems, profound people with hearing loss of all types, sometimes very mild hearing loss, sometimes very profound hearing loss. We deal with people with infection problems in the ear. And we also deal with problems with balance and equilibrium. And many times that would be a problem with vertigo, where the room whirls around, or sometimes it's something where someone has a balance issue, where they may have problems where they fall, or and that can be a serious issue, as many of you know. And hearing loss, which is what the focus of today's talk is about, is something that profoundly affects people, because it affects people and their ability to connect with one another. And one of the things that gives richness and fullness to life is connecting with others. And Helen Keller was blind and she was deaf, but she viewed her hearing loss as her most significant disability. And she did that because she said, it isolates me, it keeps me from connecting with others. It gives me, the word she used, a dreadful sadness. So we want to try and do what we can to help people that are suffering from hearing loss, and to give all of us a better understanding about how it can work with thinking and with cognition. So let's talk first about how we hear. And there is a lot that's been learned. There's some that's very basic, but there's a lot that we've learned over the years. So when you hear a sound, let me see if when you hear a sound, that sound wave is collected by the outer part of the ear. This is called the pinna, and that sound wave is funneled down the ear canal, and the sound wave hits the eardrum, causing the eardrum to vibrate. And that vibration is concentrated at the eardrum, and then it's transmitted through 3 small bones. Some of you may have learned about these in school: the hammer, the anvil, and the stirrup bones. And those bones concentrate the sound further. They make the sound transmit it more effectively, and the sound goes from the air that's present within the ear canal into the fluids that are present within the inner ear, within the cochlea and the balance system. So the stirrup bone here vibrates those sounds, and the sounds are then transmitted into the fluids of the inner ear. And within the inner ear, within the cochlea, there are delicate hair-like nerve endings. And those hair-like nerve endings are unique for a variety of reasons. They take the mechanical movement of the fluids, and they change that mechanical movement into an electrical signal. And the electrical signal then is transmitted onto the brain along the auditory nerve or the hearing nerve. And that allows us to hear. And it sounds pretty simple. It's actually much more complicated. We'll go into a little bit more about that here in just a few minutes. So there can be problems at any step of the way that can cause hearing loss. Sometimes the problem is just a problem with the outer part of the ear, a problem where the sound conduction is blocked. It may be something as simple as a buildup of wax in the ear canal, or it may be a problem where there's a hole in the eardrum where the sounds are not concentrated, or it could be a problem with one of the hearing bones or even some fluid under the eardrum. But something blocks the sounds and prevents the sounds from getting through, and that would be what's called a conductive hearing loss. Sometimes the hearing loss is a problem within the snail-shaped cochlea within the inner ear, and it can be many different types of a problem. It can be a problem where someone is exposed to loud noise, and the loud noise over time can damage the hair-like nerve endings. It can be a problem where someone is exposed to medications that may have toxic effects on the hearing nerve. It can be something that you're genetically prone to develop, where someone develops a hearing loss because of their genetic makeup. And we're learning more and more about those types of problems as well. But for whatever reason, the hearing nerves don't work, and that's a very common, in fact, it's the most common hearing loss problem that we deal with, and probably affects many of you in the room. The third type of hearing problem is a problem where there's a mechanical problem with the eardrum and the hearing bones or something in this area, and in addition, there's a problem with the nerve. So there's a mixture of a conduction problem and a nerve problem that causes the mixed hearing loss. So what oftentimes is not considered when you consider hearing loss is the fact that the common final pathway in hearing is the brain. So the ear picks up the sound, it develops it to an electric signal, and it sends that to the brain. Initially at the back of the brain in an area called the brain stem. It goes through a series of relay points within the brain and then works its way up to the upper part of the brain, which allows us to understand what's being said. So the brain is extremely important and is kind of the common final pathway where words are understood. So a person can have a problem in the brain that might prevent them from hearing. It sounds crazy, but it can actually work that way. And so the brain is an extremely important part of it. Unfortunately, it's one of the more difficult areas to study. It's pretty easy to do a hearing test where you just test and someone raises their finger if they hear a tone, but it's much more difficult to measure the brain. And we're doing more and more of that as the years go by. So let's let's talk a little bit more about the hearing with the brain, because while we pick up the sounds with the ear, the brain is actually where the understanding comes in, and it's responsible for allowing us to understand a conversation. When we test people, we test people to hear whether they can hear a tone, whether they can hear a pitch, and we also test the volume of that pitch, and we test to see how they understand individual words. But people speak in sentences, they speak in paragraphs, and the brain is where that understanding of what's being said takes place. So it's an extremely important part of things, and it's probably the part that is, like I said, less well understood. So it's important to kind of understand that hearing takes place not just with the ear, but also with the brain. So the inner ear works together with the brain, and one system can't work without the other. So the brain may be working just fine, but if the inner ear can't pick up the sound and send it to the brain, there's going to be a problem there, and vice versa. The ear may be working fine and picking up the sound, but if the brain's not picking up that information and using it properly, then a person may not understand what's being said. So both areas are extremely important for understanding and functioning in our world today. And a person can get a problem, can have a problem with their brain, and it's have you ever heard the term use it or lose it? And the brain is very much like that. If you take someone, and let's just take vision as an example. So if you take a young animal and you blindfold that animal, the brain develops differently in that animal because they're not getting visual input. So the brain doesn't develop with visual input. And the same thing happens with hearing. If a child is born deaf and they don't hear, the brain develops differently. Those relay points within the brain never fully develop if a child is never exposed to sound. So the brain is definitely a use it or lose it type of a system. And even from as an infant, that's the case. So let's talk for a minute about this whole issue of cognition. And cognition is how we think. And it's something that is more and more in the news. Many of us have known people or had family members that have dementia, where the thinking is clouded, and we're understanding more and more about what causes dementia. But let's talk about cognition and thinking and how that's affected. There was a landmark study that was done about 4 years ago at Johns Hopkins University. And Johns Hopkins is typically rated as the top ear, nose, and throat program in the country. And they did a study where they looked at the cognitive abilities, the ability to think clearly for senior adults with hearing loss versus those who didn't have hearing loss. And they looked at it over a 6-year period of time. So it wasn't just a short study. It was over a significant period of time. And Dr. Frank Lin, who was the senior investigator, found several things. They found what's called an association. So an association means the two happen together, but the cause and effect relationships haven't been worked out. So we know that there's very clearly an association between hearing loss and cognition and the ability to think clearly. And that older adults are more likely to develop problems with their cognition and thinking. The older adults that have hearing loss are more likely to develop difficulty with their thinking and cognition than those whose hearing is normal. And they found that all of us have what's called a cognitive decline, and I'm sure all of you are aware that as you have more birthdays, you don't think quite as clearly. It's a little slower to remember things and a little harder to remember things, and that's something that is a normal part of life. But what was found in the study was that there was a more rapid decline in that cognitive process over that 6-year study period in individuals that had hearing loss than there was in the normal hearing individuals. So it does seem that not hearing the sounds was associated with a greater degree of loss of thinking and cognition. So an important thing, and certainly something that all of us want to do everything that we can to avoid. And the levels of declining brain function were related to the hearing loss. In other words, someone that had a more severe hearing loss had a more rapid decline in cognition than someone who had a mild hearing loss who had a lesser decline in cognitive function. And so the difference, as you can see from the slide, was about 3.2 years. So in other words, that cognitive decline that happens to all of us happened 3.2 years earlier in people that had hearing loss than it did in people that did not have hearing loss. And so this clear association has been pretty well established, and there have been other studies that have borne that out, that have shown, yeah, that is indeed the case. Now, the question that comes up in everybody's mind, and as a scientist, it really is important to me, is why does that happen? Is it this use it or lose it type of thing where you're not hearing as much sound, so your brain doesn't work as well? And nobody really knows that, and that's the source of many studies now that are ongoing, including a very large study through the National Institute of Health that's being organized. But this link between why does it happen, and there's many different thoughts as to why it happens, but unfortunately we don't know why that occurs. But the potential explanations would be, one, when people have hearing loss, they tend to withdraw socially. So people, if I don't hear well, I'm not going to go out and be going to group gatherings or social functions. And so some people think that lack of social interaction, that withdrawal that takes place, may be the reason that the brain is not functioning as well. Again, this use it or lose it type of thinking. So another thought is that perhaps the hearing loss, and when people have hearing loss, as many of you probably know in the room, you have to really think hard about what's being said. You can't just relax and listen. You have to work at it, because people with hearing loss get bits and pieces of words, and they have to take those bits and pieces of words and put them together into a meaningful sentences and understand what's being said. So the one thought is that perhaps more of the brain function is going to that thinking process, and there's less brain function for other types of things. So that's another hypothesis, another thought as to what may be going on. And another thought is that perhaps there's a link, that somehow the same forces that cause the brain to not work as well may be causing a deterioration in the hair-like nerve endings of the inner ear, that there's a link between the two. And so, as I mentioned, lots and lots of studies going on looking at that very thing. So hearing loss, we know, is extremely common. All of us are impacted in some way, shape, or in way, shape, or form. It's about 1 in 3 people over the age of 60. So many, looking at the audience, there's many of you that are in your 60s, and about a third of a chance that you're going to be affected. About 1 in 6 baby boomers, people between the age of 49 and 69, have been affected. And then about 1 in 5 teenagers, and that's an area that's very sad, and we're seeing a lot of that because of the loud noise exposure that people get from iPhones and things of that nature. So it's becoming more and more common in teens. And then in the Generation Xers, the people that are the tweeners, not the teenagers, not the baby boomers, but the betweeners, called Generation Xers, about a 1 in 14 chance. So it's extremely common, and unfortunately, many times it's not addressed, and it needs to be. And audiologists are people who. How many of you all are familiar with audiologists? Do you all know what an audiologist is? An audiologist is someone who has a doctoral degree who's done 4 years of undergraduate work, additional 4 years of graduate schooling, and then is given a doctoral degree. And audiologists are experts in hearing and balance and can help to identify the cause of the hearing loss and can help with treatment. And we're fortunate to have 4 doctoral level audiologists at our institute, and they're all happy to help with patients with hearing loss, and we're very fortunate to have the group of audiologists that we do. And we're fortunate today to have one of our audiologists from the Jacksonville Hearing Balance Institute, and I want to just take a moment to introduce Kristen to you. And Dr. Kristen Edenfield is our lead clinical audiologist, so she's the head audiologist at our office, and she's been with the practice now for 3 years, since 2014. She is a gator, so she may chomp. She did her undergraduate work and her graduate training at the University of Florida, so she's a big gator fan. She does have board certification through the American Board of Audiology and has a certificate of clinical competence in audiology from the American Speech Language and Hearing Association. And so without further ado, let me welcome Kristen to the stage, and she's going to talk to us a little bit about hearing aids and what can be done to help prevent some of the problems that are occurring.
Thank you, Dr. Green. Can you all hear me? I bet you get asked that a lot, huh? All right, so after all that information, some of you are probably thinking that's a little doom and gloom, but the good news is that there are a lot of things that we can do to help you reconnect to the world around you if you are struggling with hearing loss. So what I do all day is try to find a way to help people reconnect to what's most important to them. So if that means you want to hear the TV better, you want to hear your family better, you want to hear your wife whisper to you, we can try to help you do that. And hearing aids are one of the most common ways that we start with that. What type of hearing loss you have is going to determine the route that we go. So hearing aids are the general route, but there are also cochlear implants that we can talk about, and there are bone-anchored hearing aids if you have a medical problem. We're not going to focus on those interventions today, but what your hearing loss looks like will largely determine what we try to do to help you. Sensory neural hearing loss, the one that Dr. Green covered, being nerve-based and inner ear-based, a permanent hearing loss, typically associated with aging or maybe some noise exposure. That's the most common type of hearing loss, and it's the one that we see most often that we attempt to treat with a hearing aid. There are a lot of options of hearing aids, and it can be very overwhelming when you're starting your journey wondering, what style do I need? Who do I go to? How come someone is advertising a hearing aid that's $199 and then someone's paying $6,000 for a hearing aid? So what's the difference and where do you start? So we're going to try to give you a starting off point today, just to give you a little bit of education so that if you are ready to start thinking about helping yourself hear a little bit better, you know where to begin. So for styles, there are 2 general styles of a hearing aid. So there's an in-the-ear product, and then there's a behind-the-ear product. Let's see, here we go. So in-the-ear products are going to be on this end. They're going to be custom made to a mold of your ear. They range from really large, so this is kind of the classic style that you might think of when you think of a hearing aid, down to really teeny tiny, where the goal is to fit the entire hearing aid in your ear canal, so none of it is coming into your outer ear. The other style of a hearing aid is a behind-the-ear product, and this will encompass a couple different degrees of hearing loss. So if you have a very severe hearing loss and you need a power device, you're probably going to end up in a hearing aid that's behind the ear that has an ear mold attached to it. The newest style and the vast majority of the market these days is something called a receiver in the canal. So a receiver in the canal, which we will call a RIC or a right, is a product that houses a lot of the components on top of your ear and then has a small speaker that sits in your ear. And there are pros and cons to all types of devices. So if you sit down with an audiologist to start talking about a hearing aid, you want to express to them what's most important to you. And if that's the way it looks, that's okay to say that. If it's the price, that's okay to say that. And if it's just hearing better, you can say that too. So let's look at some pros and cons. In-the-ear products are fantastic for the insertion of them. So they're typically the easiest style to insert. So some things we think about is if you have arthritis or vision problems and manipulating something very small is difficult for you, we'll sometimes go to an in-the-ear product because it's molded to your ear. So your job is to pick that up and just put it right into your ear canal. If you have a large ear canal, we can build you a very small hearing aid that can fit entirely in your ear. Some of the newer products are made of different materials that are designed to be very thin. So over here, and we have a titanium product. So it's made of a virtually invincible material that's very thin, so we can build it to be very small and still encompass everything that you need. They are molded, so they should be an exact fit. So there shouldn't really be any wiggling. It should just fall into place wherever it fits inside your ear. And it does also limit your hair and your wind noise. So a lot of times with a product that's behind your ear, we'll get some comments that you're picking up your hair, you're picking up the wind if you're a boater or a biker and you're in a lot of wind noise. A product that's in your ear is very protected by your outer ear. So it works just like natural hearing. Your mics are inside your ear here. So you're not picking up any extra sound that you don't want to hear. Telephone use is also very convenient with an in-the-ear product because you can just hold the phone up like normal. Hearing aids these days have become very techy, so we will talk a little bit about Bluetooth and what other phone options there are. But if you just want to pick your phone up and use it, an in-the-ear product can be very helpful for that. Some cons, and the number one con for an in-the-ear product is something called occlusion. What occlusion is when you feel like you're walking around talking inside of a barrel. So you've got your fingers in your ears, you're hearing your own voice sounding very hollow to you, very loud. Maybe you feel like you can't chew and have a conversation at the same time because your own mouth noises or your internal noises are very loud to you. With certain shapes of hearing loss, you're more prone to occlusion with an in-the-ear product. So if your hearing loss is normal in the lower pitches and then it slopes down, you may struggle a little bit more with this. So your audiologist will discuss that with you, that perhaps this is not the best style for you, and maybe we should try something that leaves your ear canal a little bit more open. If you have very teeny tiny ear canals, you may not be able to work with the smallest style of a hearing aid. So you may end up with a product that does come out of your ear a little bit into the bowl of your ear and is a little bit more visible. The reason that that happens is simply because we have to fit a speaker and a microphone and a processor inside of the hearing aid. And if there's just not the real estate in there, we end up taking it outside a little bit. In-the-ear products can create pressure points inside of your ear. So the material is hard. It's hard in an attempt to be more durable, but it can cause some pain if it's not fitted exactly right, and you would be surprised that a millimeter can make a really big difference inside your ear canal. So if it in one spot is rubbing, it's going in a little bit too deep, it can be a little bit uncomfortable. When I fit an in-the-ear product, I usually tell people this may take a couple tries. We might have to buff it, we may have to reshape it. If you are in that hearing aid for a long amount of time, your ear shape may change and we may have to change the shell again. And that's all things that we can do. It just changes your journey a little bit, so knowing that you may have to come back and just try again to get the fit exactly right. And then the other major problem that we come across with an in-the-ear product is the repair process of that product. Not a lot of repairs can be done in the office. So even though some people resist getting hearing aids, once they do get them, they tend to become very dependent on them and they don't want to have to go without them. So when that hearing aid needs some regular maintenance or it gets wet and it needs a repair, it does have to leave you for about a week's time to go to the factory, wherever that is, and then you're without a hearing aid at that point. So if you are very hard on your hearing aids, you're very prone to moisture, and you think you may need a lot of repairs, it may be best to get a hearing aid that won't have to leave you in order to get fixed. So the other alternative is a behind-the-ear product. The first pro to that is going to be the opposite of the con to the in-the-ear product, which is that in general they can be pretty non-occluding, meaning we're able to leave your ear canal fairly open because we have the ability to put a lot of the parts of the hearing aid outside of your head. We have a lot of flexibility with the way that it feels. So your hearing loss will, to an extent, determine the size of what has to be in your ear. But if you just can't tolerate it, we have some ability to back it off and just give you a little bit more venting in there to allow you to feel like you're hearing a little bit more naturally with your ear open. To many people's surprise, this newer style of a hearing aid, a RIC product, a behind-the-ear product, is actually pretty discreet. So they come in very small sizes. We have some out front at our table if you want to touch and feel them and look at them. They're very teeny tiny, and for any ladies that really have any hair, it'll just tuck right up under there. So they become pretty invisible. You mostly see them if you're standing behind somebody, and most of the time I hear that people have to look for them in order to see them. Behind-the-ear products have a lot of access to the newer features, so we'll look at some of those, but Bluetooth being the main concern, and rechargeability is a newer feature that's available in a lot of the behind-the-ear products. Because there's not a space concern, the behind-the-ear products tend to get the newer technology first. So when something is just released to the market, it always goes in a RIC or a Wright style to begin with. So those are going to be your most up-to-date as far as the features of the hearing aid go. And then the repair process, again, is a little bit easier. There are some parts that we can fix in office, so that helps with having to send the hearing aid out and going without it. The downside of a behind-the-ear product is that sometimes insertion can be a little bit difficult. So you have to be able to manipulate something up on top of your ear as well as something inside of your ear. I have trained many people to successfully do this, so if you're thinking there's no way you can do it, I bet we can get you there, but it does take a little bit of practice. The other downside is sometimes the size can get big if you're in a standard hearing aid, so a power hearing aid, if you have a more severe degree of hearing loss. The size can be large. You do get some wind and hair and glasses noise, but that is probably the number one question I get is how do I wear this style with my glasses as well? There's really not a big problem with that. They just share space up there. If you have a very tiny outer ear, we may feel a little crowded up there, so we might consider a different style, but most of the time that's not a huge issue, and you just get used to the fact that when you take your glasses off, now you can hear and feel that you are taking your glasses off. Telephone use can be a little bit different, so your microphones are going to be placed up on top of your ear. You don't want to hold the phone up against your head as you tend to do if you're having trouble hearing because you need the hearing aid to pick up the sound. So you do have to adjust your hand position a little bit to get the hearing aid to help you with the phone call. And then we may need an additional ear mold on a style like this, so that would be something that you may have to come back and we would end up taking an impression to make it a little bit more custom. It just depends on what your hearing loss looks like and how severe it is. So in the newer hearing aids, there are some really cool features. Hearing, of course, is the priority. So most of the time people come in and their bottom line is, I just want to hear better. But if we can make that fun for you, then we try to do that too. Does anybody in here have a smartphone, iPhone? All of those phones can now connect to your hearing aids. They can connect without you having to wear anything anymore for the most part. So when Bluetooth was first released, you usually had to wear something around your neck in order to connect the hearing aid to your phone. Now for all iPhone users, you can connect directly to your phone. What that does for you is it allows you to take any audio from the phone and just send it directly to your hearing aid. So if you get a phone call, now whoever is calling you is speaking right into the speakers inside your ears. And the major perk of that is they are speaking into both ears. So you are using your surround sound system to try to understand that phone call a little bit better. You can also stream music. So if you want to go to the gym and you don't want to take your hearing aids out to put in your earbuds, you can just listen right through your hearing aids wirelessly. You can also connect to a streaming device if you want to. And your streaming device can pick up things like your television for you. So if you're really struggling with television, you're having a hard time understanding it, you can plug a device into the back of your television that'll allow the hearing aid to pick up the audio from the television and send it directly to your hearing aids. That'll cut out all your room noise for you. It'll make your signal a little bit better. And then the perk of that is if you're watching TV with somebody, they can listen to whatever volume they want, and you can listen to whatever volume you want. So if that's been a problem in your household where maybe that TV's up a little bit too loud for someone else in the room, you can bring it back down significantly with some of these newer hearing aids. The other newer benefit to the hearing aids is that they have become rechargeable. There are several different styles of a rechargeable hearing aid. Some have a battery that just stays in all the time. Some have a battery that comes in and out and can be changed by you. One of the main complaints of a hearing aid is every 7 to 10 days, maybe even less than that, you're switching out that small battery inside of the hearing aid and putting a new one in. That can be difficult if you have vision or limitations with your hands and you're trying to manipulate that small battery. The other thing that happens is you will inevitably be out in the middle of a conversation and you will hear your little song telling you that your ears are dying and it's time to change your battery. People don't love changing their battery in the middle of their lunch, so a rechargeable hearing aid takes that concern off the table. The rechargeable batteries will hold a 24-hour charge at least, so you can go your whole day, and then at night they go onto a charger just like your cell phone does. So the process for getting into a hearing aid, the first thing is, of course, to get a full hearing test. So you come into a soundproof room. It's a non-invasive test, so it doesn't hurt in any way. It's very easy. It usually takes about 15 to 20 minutes. And we'll get a printout graph called an audiogram that we can review with you to tell you here's exactly where you're having trouble. If your hearing is fairly mild, we may say just knowing that you have a mild hearing loss is enough for right now. You don't require a hearing aid. Or we may say you're really struggling and you have a pretty significant hearing loss. Let's try something. If that's the case, we'll go into a consultation where we will together, the audiologist and whoever we're seeing, will discuss different styles of hearing aids, so more in detail what we just talked about and how that looks for your specific hearing loss. We'll talk about manufacturers. So there are 6 to 7 major hearing aid manufacturers, so there are a lot of products on the market. All of the manufacturers have multiple lines depending on what you're looking for. So you really need someone that can help you kind of tease that out. I can guarantee that if you go to the manufacturer's website, they will tell you that they are all the best. So having somebody that can say, maybe for this situation, this hearing aid is really helpful, and maybe for this situation, this one's not so good, is pretty useful. We sell our hearing aids in technology levels, so whether or not you want an in-the-ear style or a behind-the-ear style, the price doesn't change on the hearing aid based on the style. What changes the price of the hearing aid is the technology level built inside of it, which is basically the computer chip that the hearing aid runs on. The chip's goal is to anticipate what you need from it as a hearing aid user. The number one problem that people with hearing aids have difficulty in is background noise. So at a higher level of technology, the hearing aid is going to be better at helping you focus. The goal of the hearing aid is to get into a noisy situation and to try to identify what you want to hear. So it's going to do that through the input from the hearing aid. And then it's going to switch its microphones in order to focus on that person versus everything else around you, and to try to reduce that background noise. So the algorithms inside of the hearing aid will take a view of everything it's taking in and then try to cut back on what you don't need to hear. It will do that better at a premium level of a technology than it will at a standard or an entry level. The reason we'll recommend all different levels is very much based on what your lifestyle is like. So if you are a very active person, you're constantly in background noise every day, you're going to need a higher level than someone who's usually one-on-one. So we'll ask you some questions just about what your day-to-day communication looks like, where you're really struggling, and then we'll help to make a recommendation for what we think you need. And we'll also talk about your budget. So of course, that's an important component of hearing aids. I think it's one that people don't like to talk about as much, but it's certainly something that we'll consider. You don't have to feel afraid to say, hey, this is something that I can or can't do, and we can try to work with you to find something that's gonna meet what you need to do in order to hear better, and then also meet you with your budget to make sure you're comfortable with that. After we make some choices, you pick your colors, we'll order the hearing aid, and then we'll go through a fitting process. So the fitting process is usually an hour-long appointment. You'll come in and we'll program the hearing aids. We'll verify them using some technology where we'll have a microphone down your ear canal that will allow us to see what the output of the hearing aid is once it's sitting in your actual ear canal. And then we may do some testing with the hearing aids in to see how you're functioning with them and just make sure you're performing better than you were without the hearing aid. And we'll spend a lot of time making sure you know how to use it. So how to keep it protected and clean, how to put it in and out, and how to change the battery in it or charge it or whatever you need to do to take care of it. And then the last part of that process is we'll send you off and say, okay, you're gonna wear it for a couple weeks, and then you're gonna write down everything about it that you like or you don't like, and then you're gonna come back in and we're gonna work on it again. So everybody needs a follow-up appointment, at least one at 2 weeks. Hearing aids are very often compared to glasses, but the major difference between hearing aids and glasses is the process you go through to get comfortable in a hearing aid. So with a lot of times with glasses, you put them on and then you see and off you go. With hearing aids, you put them on and you hear everything. And the reason for that is because your brain has been without sound for probably many years at this point. We're putting a hearing aid onto you and all of a sudden all of that is coming back. And your brain's goal is to hear anything that's new and interesting to it. So on days 1 and 2, you are hearing everything. You're hearing your feet as you walk on the floor. You're hearing the fridge as it runs. You're hearing all the sounds that you're thinking, maybe I didn't want to hear everything. And that's okay. You'll get used to it. You'll adjust, and then you'll come back and we'll help you adjust with what we do through the computer, through the hearing aids. So there's a lot of counseling involved. There's a lot of understanding what we expect through the process. So at 2 weeks, you come back, and then another 2 weeks from there, you'll come back again, and we'll do some more fine-tuning. So in the state of Florida, you are legally provided a 30-day trial period no matter where you buy your hearing aids. So that's something really important to know, that you have to try them out. You should follow up with your audiologist during that point. And then if you get to the end of that 30 days and you're dissatisfied with it, it is your legal right to return it for a refund. Let's see. So we're gonna open up the floor to some questions. But I'm gonna bring Dr. Green back up and just open the floor to any questions that anybody has, either about our practice or about hearing aids, cognition. Anybody have anything? Okay, I got one back here. And she's gonna come around with the mic.
How do you factor in noise in the ears with a hearing aid, ringing in the ears?
Sure. So her question is in regards to what we call tinnitus, or it's a ringing in the ear, a noise in the ear. A lot of times tinnitus is related to a hearing loss. Hearing aids are the first line of attack for tinnitus in the ear. So a lot of times having access to sound where your brain has been deprived of it will help with that perception of the tinnitus. If that alone doesn't provide you the relief that you're looking for, the newer hearing aids have what we call tinnitus maskers or noise generators within them. They're capable of creating different sounds that are intended to relax your auditory system and to help with the perception of that ringing that's maybe driving you a little bit crazy. So we'll find a sound that you find comfortable and very easy to ignore. We'll mix it in with the sound of your tinnitus in an attempt to help you ignore it a little bit and be able to go about your day. Do you want to add anything?
Yeah, no, and that's a new feature with hearing aids, and something that's become very popular because many people that do have hearing loss also have tinnitus or tinnitus. So many of our patients do find that to be very helpful. Let's see, gosh, lots of questions. Maybe at the back? Oh,
Danny's back there, I think.
oh, okay.
Oh.
Oh, okay,
Whoever we
yeah,
wanna
Mallory.
give the mic
Okay,
to,
yeah.
go ahead.
So we'll try to.
You mentioned the fact that one of the problems might be fluid behind the eardrum.
Yes.
What would be the causes for something like that, and how do you deal with that? Is there something between a hearing aid and surgery, or what exactly, how do you relieve that problem?
Okay, that's a great question. So it is possible for someone to develop some fluid in the space under their eardrum. It's called the middle ear space. That fluid would typically occur, for instance, following an upper respiratory infection after a cold. And when someone gets an upper respiratory infection, it causes congestion of the tube that connects your nose and your ear, the eustachian tube. And if congestion occurs in that tube, it can cause fluid to form, and that fluid can cause, because of mechanical effect, a block in your hearing, a reduction in hearing. The treatment is typically initially medication. Oftentimes we'll use a cortisone product, sometimes cortisone pills, sometimes a cortisone nasal spray, and oftentimes that will, if a person is physically able to do so, combine with an antihistamine decongestant type medication. And then if the fluid persists, if it doesn't go away after a reasonable period of time, sometimes a tube can be put into the ear. It's the same type of tube that's used in small children, and the fluid can be drained away. So it's dealt with in different ways depending upon the situation. Mm-hmm. Question? Yeah.
What is the difference between a hearing specialist and an audiologist?
That's a good question. So there are several different specialties that can fit a hearing aid. So a hearing aid dispenser, a hearing aid specialist, they typically have a 6-month to 1-year certification in fitting and dispensing of hearing aids. So they can do a hearing test and then they can fit a hearing aid off of that. An audiologist has a 4-year doctoral degree in the science of hearing and balance system as well. So they can provide a comprehensive hearing evaluation. They can make a medical referral if it's required. And then they can also assess the balance system. So the education is probably the main difference between the two specialties. An audiologist can work a little bit more thoroughly with tinnitus and wax in the ears and hearing loss, whereas a hearing aid specialist or a dispenser is really going to focus on amplification for you.
And just to add to that, people oftentimes think, well, gosh, if you go to an audiologist, if you go to this person with their doctoral degree, it's going to be more expensive. Studies have consistently shown that it costs less to go to the doctor of audiology to get your hearing aid than it does to go to a hearing aid dispenser. And so it doesn't cost more. That's kind of a misconception that's out there. And oftentimes it's hard to tell if someone is a hearing aid dispenser or if they're a doctor of audiology, and you have to, excuse me, you have to just ask that question, because sometimes if you were to put in to a computer system, if you were to put in audiology for a search engine, a lot of times hearing aid dispensers will come up. So you have to ask that question, because there is a big difference in training. Question? Yeah. Hang on one second. We're going to try and get the microphone over to people so that everybody else can hear.
Hi. Okay. Hi. As a doctor of audiology, medical doctor, I really appreciate your information. I understand that there's new legislation on over-the-counter hearing aids. And as a professional in that field, possibly do you recommend those for someone that might have a little milder hearing loss? And would you dispense that?
Yeah. So that is a topic I could talk a while about, but I'll try to condense that answer. So yes, the bottom line is yes, I think that over-the-counter devices can be a really great introduction to a more traditional hearing aid down the line. They're going to be we expect them to be FDA approved for a mild to moderate degree of hearing loss. There's a pretty big difference between a mild and a moderate hearing loss. So if anyone out there has a moderate hearing loss, they know that that's pretty severe. You may want to consider a traditional amplification route at that point, but I definitely think access will be improved. I never think it's a bad idea for people to start investing in the technology that we'll be using. That's only going to bring good things for the audiologist and for the people that they're working with. I think it's a great product to get you used to what to expect with amplification and kind of get your feet wet for trying something more traditional.
Yeah, and I think it's an area with the legislation just having passed, we don't know exactly what it's going to look like. I mean, will a person be able to go into, Walgreens or CVS and buy a hearing aid? We think that they probably will. The whole issue of cost and how that's going to be fitted and where do you go if there's a problem with it. There's still a lot of unknowns in that area, and it's going to be a while before that's going to be available. I think the Food and Drug Administration has given a 3-year period of time for the rules to come forward, so it's going to be a little while before people can actually go to Walgreens or CVS and actually purchase a hearing aid.
And I'm going to put one more disclaimer on that. I do think a traditional hearing test is always a good idea before you start with a product like that, because there are many times that we can help you with just cleaning out the earwax in your ears or making sure it's not something like an ear infection. So get a traditional hearing test first, even if that's just serving like a baseline for us to watch you, and then we will recommend something like an over-the-counter product if that is going to be appropriate for you.
Other questions?
I think we have one right up front here.
Oh, okay.
I understand that hearing aids are your first line of defense to help with that.
Mm-hmm.
Is that the route you take even before discussing any type of like cochlear implants? Do you do that and then go that route? Or do you know that already and then try to steer the patient away from the hearing aid?
So part of the FDA criteria for a cochlear implant is a device that's used for severe to profound hearing loss. Part of the FDA criteria is that you're no longer receiving benefit from a hearing aid. So 99% of the time, those people have been in a hearing aid for a very long time and are just not getting benefit from it. If we do receive somebody to us who is profoundly deaf and we know that there's no chance that they'll be helped with a hearing aid, we may expedite the process a little bit to get them right into an implant, but almost always we start with at least a trial of a hearing aid because it is obviously the non-invasive option, and it's a reversible option, whereas an implant is not a reversible option. So if you can get help with a hearing aid, that's where we'll start you, but that doesn't mean an implant's off the table if it's not doing what it needs to do.
Okay, and one more quick question as
Yeah.
far as the technology levels.
Mm-hmm.
Are those levels on the rechargeables, are there levels in the rechargeable
Yes.
devices?
Yes.
So you could do the rechargeable based on your budget?
Yes, and you can do a Bluetooth hearing aid based on your budget too.
And there are some of the older hearing aids that you can retrofit, that you can put a little something onto to make them rechargeable. So there are a few devices out there where you can do that.
If she has some hearing devices already, could they be looked at to see if
Of course.
they would
Yes, yes.
could be readjusted?
Yes, so an audiologist can work with any hearing aid manufacturer that's not proprietary. So Miracle Ear, that's a proprietary company, so only someone from Miracle Ear can work with them, but any of the major manufacturers and any audiologist can continue to work with the hearing aid.
Yes.
Thank you for coming. Thank you for the presentation. Excuse me. You mentioned that hearing loss could be nothing to do with the canal, the middle ear, the outer ear, but could be brain specific.
Right.
How do you go about making that diagnosis?
Okay, that's a good question, and I'll answer, and then Kristen can maybe answer on top of an addition. So anyway, so we start with a hearing test. So we would try to see, is the auditory system working properly? The eardrum, the hearing bones, the hearing nerves within the ear, are they working properly? And if that system is working properly and someone is still having significant difficulty with understanding words, then we may well, and it's significant, it's a problem for them, then we may go ahead and move forward with an evaluation looking at the central nervous system and how it works with hearing. And there are tests to do to look at that as well. And Kristen, thankfully, is the one that does that, so she might want to add to that. So it happens. It's kind of the exception to the rule. Most of the time, if someone has difficulty understanding words, it's much more likely to be a problem with the ear than it is a problem with the brain. But both areas can cause difficulty understanding words.
Yeah, so that's a very good answer. And the situation where you have totally normal peripheral hearing and then a central problem is something called a central auditory processing disorder. There's testing that we can perform once we've verified that your hearing is normal in order to tease out any problems with your central system. If you are possibly having central processing problems and peripheral hearing, that's very difficult to tease the two apart. So we usually treat instead of trying to figure out exactly where the problem is. We say, we know you're having a problem, here's where it is, it's background noise, or it's integrating two people talking at the same time. So we just try to get you some help for that, even if we can't pinpoint exactly what's given you the problem.
One more follow-up?
Yeah, sure.
Short answer. You mentioned the iPhone
Yes.
and Bluetooth. What if you have an Android?
There's one manufacturer that has just released a made for all phones product, so it can stream from the Android. It only streams phone calls from the Android, so not music at this point. I know, I'm sorry, Android users.
I think there's one more question over there. Thanks, Dan.
I realize it may not be within the scope of your presentation, but could you briefly touch on the relationship between hearing and balance?
Sure. So the hearing part of the ear, the snail-shaped cochlea, is connected to the balance part of the ear with the 3 balance canals, and so the two are very much interconnected. There's the same fluid that flows between the two. And so oftentimes if someone, for instance, loses some hearing in one ear, they may have a loss of balance function in that same ear. So the two are definitely interrelated. That being said, frequently we'll see a problem in the hearing part of the ear that doesn't affect the balance part of the ear, or vice versa. Someone will have a problem with the balance part of the ear on one side that spares the hearing part of the ear. So while the two are connected, there is oftentimes a separation in the way that they're affected.
A lot of times we'll get the question, can my hearing loss cause me to be off balance? The answer to that is going to be just a hearing-related problem is not going to cause you to have vertigo or dizziness. So something is happening to your inner ear that's affecting both organs to cause you problems with your balance.
So I think there's a question over here.
What about Medicare? What about testing and product?
Okay. Yeah, Medicare does cover medically related hearing testing. So they wouldn't test you like for a screening, but if you were having difficulty hearing, Medicare would cover that evaluation. So they would cover the hearing test, the medical evaluation, and any, if you had to have an MRI scan or anything like that, that would all, of course, be covered through Medicare. Unfortunately, and this is and I've actually had conversations with congressmen and senators and others that, unfortunately, hearing aids aren't covered through Medicare in general. There are some of the supplements, some of the Medicare supplements that do have some help for hearing aids, but unfortunately most of the supplements do the same thing that Medicare does. So the VA does cover hearing aids if it's a service-related problem. So if someone was in the military, had hearing loss from their military service, and it could be established it was related to that, then the VA potentially would cover hearing aids for them. You have to go through the hassles of applying for it and getting approval and that type of thing, of course.
With this screening test that we just took, if there is a referral, would that be considered, it's saying see an audiologist, would that be sufficient to qualify for
It's
the
going
kind
to
of testing you were just talking about.
Sure. It's going to depend upon which Medicare plan you have. Most Medicare plans do not require a pre-authorization to go see a doctor or to get a hearing test. But there are some of the Medicare plans, some of the special Medicare plans that do require pre-authorization, things of that nature. Most of them do not. That's rare. So if you did not pass the screening test, then it would not be necessary to get a referral in general to come in if you're a Medicare patient.
Our office would be able to give you specific information on your insurance of whether or not we needed an order. If you want to go directly to an audiologist, we may require something from a primary care physician, but Dr. Green is able to order from us. So if you come in to see Dr. Green, he can order from an audiologist.
Okay. Well, how about one more question, then we'll be glad to take questions afterwards individually if you all have some individual questions.
I don't know if you can answer this, but I came today for the screening
Yes.
and the information. I didn't feel I had a hearing problem. I haven't noticed anything other than people telling me I'm going deaf. That's the only indication. And I expected to fail parts of this test, but are there any just day-to-day things that someone with mild hearing loss would experience? Because I don't notice anything, but obviously I have some
Sure.
mild problem.
Sure. So with a mild degree of hearing loss, you're going to have probably the most difficulty in a background noise situation where there's a lot of other things going on around you trying to understand speech. With certain mild degrees of hearing loss, you may not notice anything at all, and it may depend on what pitches that's falling in of whether or not it gives you a problem. We have seen two people with the same hearing loss, one person entirely debilitated by it, one person swearing they're totally normal. So how you perceive it can be very different based on you. But usually with a mild hearing loss, quiet is fine and background noise is where you have the most trouble.
If I'm not aware of any problem, is there any need to do anything about it?
Yeah, usually if someone has a measurable hearing loss on a screening, we usually recommend that they have a formal hearing test. There are sometimes medical conditions, things of that nature that can present problems, and some of them that can be significant. So it's best to go in and get a formal hearing test if you didn't pass it, even if it's not causing you significant problems. And then that can serve as a baseline. If there's a problem down the road, you've got a baseline, and that can be very valuable down the road.
But the answer to the hearing aid, maybe the hidden hearing aid question there is we typically don't recommend hearing aids if you're not noticing any type of problem.
Thank you.
Mm-hmm.
The old saying, if it ain't broke, don't fix it.
Yeah.
So great. Well, we just want to thank all of you for taking the time to come today. And like I said, we'll be around to answer questions. We're going to continue with the screening for a period of time for those of you that we're so fortunate to have such a great number of people come today. But I know some of the people weren't able to be screened beforehand. We'll try to screen everyone we can afterwards as well. Thank you so much, and have a great day.